Hello everyone, today we are going to study fracture. It is one of the orthopedic topic, most important topic for the exam purpose. Okay, at first we study the definition of fracture. Definition of fracture. Here, fracture is a break or breach in the continuation of bone. So, what is fracture? Fracture is the break or breach in the continuation of the bone. So, these are the points you have to write. These simple points you have to write, otherwise you will not get the. Now next, classification of fracture. Classification. At first, we'll classify the fracture according to the etiology. Okay. On the basis of etiology. Etiology means cause. The basis of etiology. It is further subdivided into number 1, traumatic fracture. Traumatic fracture. What is the traumatic fracture? A fracture sustained due to trauma is called traumatic fracture. Example, fracture caused by a fall or RTA. RTA means road traffic accident. Okay, or any type of fight. Okay. On the basis of etiology, the first is the traumatic fracture. Traumatic fracture, a fracture which is sustained due to trauma, mainly external trauma, due to fracture caused, example, fracture caused by a fall, RTA, or is known as the road traffic accident or fight. Number 2, pathological fracture. It is important question. Short note. Important short note comes in the exam. Okay. What are the pathological fracture? A fracture through a bone which means the bone is made weak by some underlying causes or disease. It may be, you can say disease. Underlying disease is called pathological fracture. The causes of pathological fracture. Causes of pathological fracture. Number A, one minute. Number A is the localized disease. Is some underlying disease. Some underlying disease is a fracture through a bone which is made weak by some underlying disease. Now, this underlying disease are the cause of the pathological fracture. So, number one is the localized disease. Under localized disease, one is the inflammatory. Like pyogenic osteomyelitis and tubercular osteomyelitis. Number 2 is neoplastic. And the neoplastic is benign tumor like giant cell tumor or chondroma. And number B under the neoplastic, malignant tumor like osteosarcoma, Ewing sarcoma. Okay, these are the neoplastic causes. Now after the localized disease, now number 2 point is the generalized disease. Number B, generalized disease. In generalized disease like hereditary disease like osteogenesis imperfecta and osteopetrosis. Okay. Number 2, hereditary acquired disease like osteoporosis is an acquired disease. Osteomalacia, rickets, scurvy, these are etc. These are the acquired disease under the generalized, and these are the main causes of pathological fracture. Okay. Sometimes short notes come. Now, number after pathological fracture, on the basis of etiology, number 1 was the traumatic fracture, number 2 pathological fracture, and comes to number 3 stress fracture. What is stress fracture? It is specialized type of fracture sustained due to chronic repetitive injury, that is stress injury. Causing break in the bone, that is the stress fracture. So these are first classification on the basis of the etiology. Now second one, on the basis of displacement. The basis of displacement. Number 1 is undisplaced fracture. What is undisplaced fracture? Absence of significant displacement. Number 2 is displaced fracture. Presence of significant displacement. Stop. The displacement is due to the fracturing force. Next, the muscle pull. Next, the gravity. Next, the displacement can be in the form of shift or angulation. Okay, now number 3, on the basis of relationship with external environment. Under the basis of relationship with the external environment, number 1 is close fracture. The fracture not communicating with external environment is known as the close fracture, where the underlying skin and soft tissue are intact. Okay, number 2 is open fracture. In open fracture, same the definition will be the fracture with break in the overlying skin and soft tissue. Here no, where the underlying here the skin and here intact, soft tissues are intact, underlying skin and soft tissues are intact, but in here break in the underlying skin and soft tissue. Okay, this is the differentiation. Leading to communicating with external environment. Okay, now it is further subdivided. This open fracture is further subdivided into 2. One is internal open or compound fracture. What is this? The sharp fracture and pierces the skin from within. अंदर से जब सब फ्रैक्चर एंड वो पियर्स कर जाता है स्किन, तो दैट इज़ द इंटरनल और ओपन फ्रैक्चर और कंपाउंड फ्रैक्चर. एंड नेक्स्ट वन इज द external open or compound fracture. Here any object causing the fracture from outside, which lacerates the skin and soft tissue over the bone. Now, number 4, on the basis of complexity of treatment. On the basis of complexity of treatment, it is further subdivided into simple fracture. Here fractures occurs in 2 pieces. Easy to treat. As per example, transverse fracture of humerus is a simple fracture. And number 2 is complex fracture. Fractures in multiple pieces, 2 or more pieces or multiple pieces, usually difficult to treat, called as complex fracture. Example, comminuted fracture. Comminuted fracture of tibia. Next, number 5. Number 5 is on the basis of pattern. Basis of pattern further subdivided into transverse fracture. In this fracture, the fracture line is perpendicular to the long axis of the bone. I will give the diagram after completion of this, all the fractures and fracture types. So such fracture is called as the transverse fracture. This fracture, the fracture line is perpendicular to the long axis of the bone. The fractures occur, which commonly occurs due to bending force. Number 2, oblique fracture. Okay, fracture line is in this. The fracture line is oblique. This known as the oblique fracture. Number 3 is spiral fracture. The fracture line runs spirally in one or more plane. Caused due to twisting force. Okay. Number 4, comminuted fracture. Comminuted fracture. What is comminuted fracture? Comminuted fracture is fracture with multiple fragment, where the fracture occurs, 2 or more pieces of fracture, 2 से ज़्यादा जब फ्रैक्चर का फ्रैगमेंट हो जाता है तब दैट इज नोन एज द comminuted fracture. Here a comminuted fracture caused by crushing or compression force. The last is the segmental fracture. The segmental fracture is also known as the compression fracture. Okay, here there are 2 fractures in one bone, where there are 2 fractures in one bone at different level is known as the segmental fracture. Next, number 6, on the basis of number, single fracture, when fracture So one fracture, sorry, one fracture in same bone to multiple fracture. More than one fracture in same bone or different bone. Okay. Next is the number 7. On the basis of complete or incomplete. So in the name is complete fracture. The whole thickness, the whole thickness of the bone is discontinued. Complete fracture. Here, fracture does not involve the whole breadth of shaft and a portion remains intact. So these are the classification or types of fracture. Okay, next we'll study next is the healing of fracture. It is one of the important questions which frequently comes in the examination. The healing of fracture. Okay. A fracture begins to heal soon after it occurs through a continuous series of stages. So fracture begins to heal soon as a continuous series of stages. So what are the stages? Number A is known as stage of hematoma. It is known as the first stage is the stage of hematoma, which lasts less than 7 days. You can say it is of 0 to 7 days. The stage of hematoma. In this, at first, fracture of bone occurs. Okay, as soon as the fracture of bone occurs, then it comes blood leaks out through the torn vessels in the bone. At first, fracture of bone, then after immediate fracture of bone, the blood leak out through the torn vessels in the bone. Next, formation of hematoma between and around the fracture. Okay, after blood leak out through the torn vessels through in the bone. Next, there is formation of hematoma between and around the bone occurs. Next, the periosteum and local soft tissues are striped from fracture end, along with fracture end, along with ischemic necrosis occurs of the fracture end. After ischemic necrosis occurs, there is deprivation of blood supply, along with some osteocytes, which are the bone cell, die. Osteocytes die. After this, there is differentiation into daughter cells occur. These cells later contribute to the healing process. So this is the first stage, which is stage of hematoma. Next, number B is the stage of granulation tissue, which is up to 2 to 3 weeks. The stage of granulation tissue. Okay, here at first sensitized precursor cells, which are the daughter cell, produce cells and which differentiate and organize to provide blood vessels, fibroblast and osteoblast. Next, granulation, or you can say soft granulation. Soft granulation, tissue in the space between the fragment. Then the blood clot gives rise to loose fibrous mass. Next, this clot is eventually removed by macrophages and giant cells. Next, the granulation tissue further differentiate to create osteoblast, which forms the bone. So this was the second stage, which is stage of granulation. And number C is the stage of callus formation, which lasts 4 to 12 weeks. Here at first the granulation tissue differentiate and create osteoblast. Next, these cells create intercellular matrix, which intercellular matrix with calcium. Then formation of callus, which is also called as the oven bone. The callus is also called as the oven bone. Next stage is the D. Okay. Stage of consolidation or new bone formation. One to 2 years. Okay. These oven bones or callus is replaced by mature bone with typical laminar structure. Number E, the stage of modeling or remodeling. Usually many years it takes. The bone is gradually strengthened. Then okay, so here are the types of fracture: simple and compound fracture, here green stick fracture, transverse fracture, comminuted fracture, spiral, compound fracture. So you can draw the schematic diagram. See from here, green stick fracture, simple fracture is slight, compound fracture this, comminuted fracture more than one fracture, which is impacted fracture. Here it is normal, it is green stick fracture, means only the slight. This is oblique fracture, this is transverse, impacted, torus, linear, spiral, segmental fracture, comminuted fracture. These are the diagram of the fracture. Okay, this is the stages of fracture healing. Okay, stage 1. This is stage 1. Stage 1 or stage of hematoma. This is stage 2 or stage of granulation tissue formation. Stage 1 is hematoma. This stage is granulation, stage of granulation tissue formation. Stage 3, stage of callus formation. Stage 4, this is stage of consolidation, and this is stage 5. It's a stage of modeling or remodeling. Okay, thank you.